Hello, everyone. We had about 70 people in the waiting room, so we're just waiting for everybody to trickle in, and then we will get started. Thanks for joining us on this gloomy summer day. Gloomy and cold. MOVA team, you can still see my screen, right? It didn't. Okay, great.
Thank you.
All right, we have about 100 people in attendance, and it is 1 o'clock, so I'm going to get us started. Before I jump into introductions of our team here, I just wanted to share a few pieces about our Zoom webinar today. So this is a Zoom webinar. You cannot be seen or heard as audience members, but you can see the presenters and presentation. There will be closed captions available during today's session. To view the closed captions, please go to the bottom of the screen, click on the up arrow next to the live transcript, and choose Show Subtitle. If you are experiencing any tech issues today, please use the chat function and message all panelists, and someone will be happy to assist you. Additionally, because this is a webinar format, we will ask that any questions that you may have throughout the presentation go into the Q&A function found on the Zoom toolbar. Any questions that are placed in the chat function may be overlooked, and we'll do our best to address any questions that are placed in the Q&A, and we will definitely leave time at the end for any additional questions that come up throughout the presentation. Lastly, this presentation is being recorded, and we anticipate that the recording will be available on MOVA's website within the next week. And Stephanie from our team here has dropped this information in the chat box as well. Moving on to introductions. So I just went over the housekeeping. So I will pass it along our MOVA team to do some introductions. I am Kristen Wen. I'm the Director of Grants Administration, and I will be doing a good portion of the training today. So Liam, I will pass it off to you next.
For introductions, for purposes of introductions, I'm Liam Laney, and I'm the Executive Director of MOVA. Happy to be with you all today, and I'll kick it to Madeline.
Hello, everybody. Thanks for joining us. I'm Madeline Gorman, she, her, hers, and I am a Deputy Chief of Staff at MOVA.
Hi, everyone. Thanks for joining us today. I'm Kristen Tavano. I'm Deputy Director of Grants Administration at MOVA, and I will hand it back to Kristen.
Thank you. I also want to acknowledge we have Isabel on the call today. Isabel is our policy specialist. Isabel, if you'd like to introduce yourself really quick. I recognize we don't have your name in the introductions because this was a last minute decision to add you in due to all the bridge conversations currently, but the VOCA bridge conversations happening right now. So if you'd like to introduce yourself, and then we can move on to the meeting objectives.
Sure, no worries. Thanks, Kristen. My name is Isabella Lara. I am one of the Policy and Legislative Affairs Specialists at MOVA, and I am open to any questions come the end of the presentation regarding VOCA Bridge or if things come up. So thanks for having me.
Thank you for joining us. I know that this is probably a question, or these questions are at the front of everybody's mind. So thank you. For our meeting objectives today, so as most of the attendees know, we do one of these trainings annually. It's to help you develop a clear understanding of what changes have been made to the MOVA Victim and Survivor Services Policies and Procedures Manual. This applies to all of our grants that we administer at MOVA, and of course to answer any questions that you may have about any changes that we made or just general policy questions. For our agenda today, Liam will provide some opening remarks about the funding picture and where we are at with our VOCA Bridge advocacy efforts. And then we will move along into the key changes that have been made to the FY2025 version of MOVA's policies and procedures. I will go over the funding allocation review. There are not any significant changes that have been made to that section of the policies and procedures, but we do want to highlight some key pieces of tracking awards that are funded by multiple sources. Madeline is going to go over some changes to the outcome measurement tool reporting. I will be clarifying some documentation requirements of subcontract consultant requirements and going through bonuses, which we have seen an uptick of bonus requests on budget amendments. So just going through the allowability of that and things to consider and some limitations that we may have as part of our policies and procedures. Madeline will go through the civil rights requirements, and I will also be highlighting upcoming changes to the Code of Federal Regulations, which is the uniform guidance. Lastly, we'll go through some common technical assistance topics and trends that we see when day-to-day grants administration, and go through any questions and answers that came through during registration, and we'll leave some time for some open Q&A. With that, I will pass it to Liam to go through some opening remarks.
Thanks, Kristen. Hello, everybody. Great to virtually be with you. I hope you're having a wonderful summer. It's certainly been hot, so I hope you're enjoying the benefits of that or staying cool and avoiding the negatives of that. I was just going to take a couple minutes today to talk about the funding picture, which has become a regular part of the PNP in the summer, and so we don't want to disappoint you this time. But as it relates to the policies and procedures, and thanks to the MOVA team for their work on this and constantly reviewing it and trying to streamline it some. And at the end of the day, our goal with these are to provide you the tools so that you can remain in compliance with state and federal rules while providing the services that you need to provide in the way you need to provide them. And so I hope your big takeaway today is always, it's a document. We're not going to anticipate every single thing. Please ask questions as they come up. Our team really wants to work with you. We want to help you do the work that you're trying to do for survivors day in and day out. And we really want to work with you to try to find ways within the funding requirements for you to do that work. So please don't hesitate to reach out to the team or us and ask us about these policies and procedures. So funding, I'm sounding like a broken record, but today is a big day. We're hopeful that the $20 million that's needed to fulfill the VOCA bridge that we've been asking for with your assistance will be passed by the Massachusetts legislature. The Senate is going to begin debating Senate Bill 2888, which is a supplemental budget that was filed by Governor Healy. They're going to be debating that at 1 o'clock today. So right now, assuming they're on time. You may know that this budget was submitted by Governor Healy. A version of it was passed in the House of Representatives that included the $20 million VOCA bridge funding, and now it is before the Senate, and we expect them to be debating that today. We are anticipating that a majority of the senators will vote in favor of that later this afternoon. And should that happen, the bill then, of course, goes to a conference committee where they create a uniform version of the bill that'll go back to both houses and then on to the governor for her signature. So we don't know how long it'll take in the conference committee. Could be quick. We don't know how, whether that'll take a few days. And then once it goes to the governor, technically the governor has 10 days to sign the bill into law. Obviously, we're going to be watching and providing updates to you as it progresses through this. This is a very busy time in the legislature. I know all of us that follow them and follow the work over at the State House know that so much happens in July because it is the end of their session, their formal session anyway, at the end of July. So we are very optimistic about what's going to happen today. And as soon as we have news, we're going to pass it on. As Isabel said, she's going to be here if there's, questions about the VOCA bridge. I can tell you that we would not have been as successful as we have been together had you all not reached out, told your stories, told about the impact that's happening in your community to your legislators. VOCA bridge, the terminology is something that is very well known over at the State House now, and it wasn't 3 years ago as we first started this notion. Legislators seem to know and understand what VOCA is, and they know the importance of funding victim services. And so thank you for that. Thank you for your partnership in this, and we're going to keep working with you to see this through. That's for these contracts, and we will continue to have conversations about future years. We are not out of this crisis yet, and there's a lot of work still to be done. But we're going to celebrate the small wins as we get them. And I know our grants team is ready to, as soon as we get confirmation by the Senate and by the governor that we have that access to that extra $20 million, our grants team is ready to work with you to update your contracts to the other dollar amount. So we're hopeful. Nothing's done until it's done, but we're hopeful that it's going to be a good day from this perspective. So thank you for all of your help on the VOCA bridge, your partnership, and everything that you're doing every day, meeting survivors, working through regulations, working through policies and procedures, and supporting the people that are coming to your doors. Really, really appreciate it. And I hope you have a wonderful summer. And I'll kick it back to the team.
Thank you, Liam. And I would just echo to what you had stated. Our team is ready, preparing, ready to get the funding out should we receive it. So thank you for sharing the update, Liam. And as it says in the slide too, make sure you are signed up for our policy and constant contact list to make sure you're receiving those updates too. All right, I don't see any immediate questions about that. So Isabel will be on the line just in case anything comes up. And if there are any relevant questions that come up towards the end of this session. So with that, I will jump into a funding allocation review. Yes, Kristen Tavano, would you mind putting the link for the Cognito form sign up in the chat, please, when you have a
Sure.
second?
Absolutely.
Thank you. Thanks so much. So funding allocations in FY24, and for some programs this year, right now, as you all are familiar with, we're working on securing that VOCA bridge dollar. So as part of contracting this year, initially the primary source of funding is currently VOCA. Hopefully that can be a mix of VOCA funding and the VOCA bridge funding, which is a state allocation. So during contracting, every program will receive an award notification and an award detail notification in eGrants that lists out what funding allocations you are receiving from MOVA. And throughout the last year, so FY24, we have been receiving VOCA bridge dollars for a couple of years now. And FY24, we're working on our systems to navigate how to manage both funding streams in a way that we are mitigating any reversion that could potentially go to back to the state or back to our funders at OVC with VOCA funding. So through this process, your program may have received notification that your funding allocation changed. And a lot of questions that we get is, why did this happen? So that could be due to anticipated or forecast reversion. That may not be necessarily your program, but if we're seeing a trend of potential reversion across several different programs, we make some funding allocation swaps, and this is in order to spend down to the maximum of our ability. No matter what funding stream you are receiving from MOVA, so if it's VOCA funding, the VOCA Bridge funding, the Drunk Driving Trust Fund, Human Trafficking Trust Fund, Safe Plan, the policies and procedures remain the same no matter what source of funding you are receiving. So we wanted to clarify that piece. I know a lot of programs may have received some funding swaps throughout the last year. We have a strategy moving forward where we can hopefully minimize the need to continue to swap allocations across programs. But we wanted to take the opportunity to clarify why that may happen and also where to find this information. So this information is, again, in your award notification. It can be found on eGrants. And I'm just going to go over the requirements of that too. So when you are receiving any funding from MOVA, whether it's one single source of funding or if you are receiving multiple different sources of funding in order to support your award with MOVA in any given year, all subrecipients must have a financial management system in place that has the ability to track all expenditures and all reimbursements that are related to your MOVA award. Your accounting system must have the ability to delineate any financial activity that is specific to your MOVA award. So this would be any expenses related to your MOVA award, separated from any other sources of revenue or any other grants that your agency may receive. All of the revenue for MOVA issued reimbursements must be tracked by funding source. So that, again, the award letter details will have the specifics of what funding streams you were given. You can also find this information in eGrants. So when you're in the eGrant system, when you go into the expenditure report summary, there's at the bottom of the summary, there is a MOVA use only section, and that details what funding source was used to pay for a particular month. So that is another way that you can access this information to see what funding source you're being paid from. So one example, if your award is paid half of VOCA funding and then half of the Drunk Driving Trust Fund, you would be able to see, let's say that you submit your expenditure reports from July through December, spending down 50% of your award. You would be able to see that in eGrants to see that any of those given months were paid by VOCA or the DDTF funds. And that's just an example. Definitely, if there are any questions related to where to find that information, contact your program coordinator and they can help you track that down. This year, in our revisions of the policies and procedures manual, we added some more specific examples of attribution statements to use when using combined funding sources. We're hopeful that we'll continue to receive this VOCA Bridge funding and that combined funding sources will likely be a source of the future. And any materials that you distribute, so pamphlets, brochures, they must have attribution statements if it's advertising the services that are supported with your MOVA award. So page 16 and 17 of the updated policies and procedures manual. And Kristen, I'm going to ask if you can add another link in the chat if you can link the updated policies and procedures manual. It was sent on Constant Contact, but just while we're going through a high level overview of what has changed through the presentation today, I just want to make sure that everybody has the version that we are referring to.
Sure, we'll do that right now.
Thank you. So again, this version you can find some more specific examples of attribution statements to use. I am going to pass over to Madeline to talk about the outcome measurement tool updates.
Hi, everyone. Although there aren't a lot of substantive or large updates to the policies and procedures for your awards for FY25. There are some changes that were made to the OMT. All of this information that I'm going to talk about right now is information that was covered in messaging that went out, I think it was in early June. And it's also available on MOVA's website under the OMT page. I believe in one of the later slides, there's also a direct link to that webpage. But the first thing I wanted to talk about is the time frame for reporting. All of the deadlines for quarterly OMT reports will all stay the same. The due dates will still be following each of the 4 quarters of the fiscal year. One thing that has caused confusion in the past is that the federal funding we receive follows the federal fiscal year, so starting on October 1st, but the awards that we administer at MOVA start on the state fiscal year, so July 1st. In the past, we have followed, for reporting, we have followed the federal fiscal year, so it was often a point of confusion that everybody that was being reported in the OMT was reported as new, not on July 1st, but on October. So we have recently received updated guidance from OVC that we can determine the start and the end of that award cycle and when the reporting should happen. So starting in FY25, our reporting cycle will align more with the way that we administer the awards, so along the state fiscal year. So at the beginning of the state fiscal year, the beginning of your FY25 award is when anybody you serve will be reported as new, if it's the first time that they are receiving services or activities that are supported by your award in FY25. This used to happen during the second quarter. It'll now be happening during the first quarter. At the other end of that, there are also annual questions, and we will now have people be completing those annual questions that are a part of the OMT at the end of the state fiscal year. So during your final submission of the OMT, your period for OMT, is when you will be submitting those annual questions for your FY25 awards. There'll also be reminders in eGrants that will help you along the way. As you're doing this, there'll be a reminder that people should be counted as new. There'll be a reminder to complete annual questions. Hannah and Amelia, our data team at MOVA, also often will send out emails letting people know that a reporting period is open, and will include those types of reminders that this is the quarter that everyone should be reported as new. This is the quarter you should make sure that your annual questions are completed. So that will continue to happen this year. The annual questions are also available to you throughout the year. While it's not required that they're completed until the final due date, July 31st, those questions fields are available to you throughout the year. So if it's helpful to be adding information to those questions kind of as you go and as you work through the year, that is perfectly acceptable. We don't collect that information or review that information until the end, until your last reporting period. Okay. There are also some new reporting fields that are available in the OMT this year for FY25. A lot of these categories we added as a result of reviewing all the information that was being submitted to us. So a number of these additions are things that are very commonly being reported in the other categories, and it felt like it makes sense to, as opposed to lumping them into other, they were fields that made sense to have an identified place for that information to live and to be reported. So the new reporting fields that you'll see available to you during your first OMT report, so that'll open on October 1st and be due on the last day of October. These are the new fields that you'll see available. So as far as the victimization types go, there will be an addition of court protective order violations and also of community violence. One thing that I did want to highlight is that there will be the removal of the not reported or not tracked field from the victimization category. Almost all of the fields have an option for the data either not being reported or not being tracked. This is the one area where that is not true, as the victimization type is really kind of one of the requirements. Knowing that somebody has experienced some type of crime is something that would make them eligible to receive those services. So in addition to the victimization type category changes, there are also a few additions to the special classifications, all of which you can see on the slide right now. One other thing I wanted to highlight is the addition. So this is for safe plan awards largely, but the addition of coercive control to Chapter 209A of Mass General Laws is probably something that a lot of you already know about. It was a recent change, but when this goes into effect in the fall, you will be able to see in your OMT that under type of abuse alleged, there will now also be an option for coercive control. So if you're assisting somebody with an order of protection and that's the type of abuse alleged, there will be a place to record that. There will be more information about this coming soon for safe plan programs, so in the coming months, so please stay tuned. One thing that I'd like to add about the reporting fields is that we do expect for all of these reporting fields that, people are using, using their best judgment, their experience providing victim services when they're collecting data. We know that you might not be able to get all of this information every time you interact with somebody. We don't expect that, for example, if you're answering a hotline phone call, that you're asking every single question on the OMT. I think the expectation is that there is the capacity for your agency to be able to record and report this information if it's presented. But we do expect that you all are using your best judgment when collecting the information, following your agency's policies about how you collect data. All right.
That was the last slide on that. There were a couple of questions that Kristen has answered in the Q&A about the OMT changes. I don't know, Madeline, if there's any that you just verbally wanted to confirm out loud too related to this topic.
I am looking at them while we are speaking. Do outcomes remain the same is one of the questions. I'm assuming that's talking about the goals and key outcomes that everybody set up for their award. Yes, those remain the same. Everybody had the opportunity while they were doing their contracting process for FY25 to either copy forward the same goals and key outcomes as they had in FY24 or adjust those accordingly. Obviously, if awards amounts change moving forward and people want to adjust those goals and key outcomes, there will be a process for that, and it'll be part of when everyone needs to re-sign a contract, there'll be a process for that as well.
There's a question about definitions that just popped in. I'm actually going to be covering the definition specifically related to this question during our Q&A portion. So I'll pause on that for the time being, but it's definitely something that we will be addressing.
I also saw, just before we move on, this is also something that we'll be addressing in the Q&A, but I did see a question in the chat about what services should be reported in your OMT, and there'll be more information on this, but the quick answer is everyone should be reporting in their OMT the individuals who were served and the services that were provided as a result of the MOVA administered award. So if there are other services that your agency is providing if there are other people that your agency is working with that are not related to your MOVA administered awards, those should not be included in the OMT. The OMT should be reflective of the activity that is related specifically to the award that you're reporting on.
Thank you. All right, with that, I am going to go into the next training portion. So this piece of the training, so I'm going to go over the subcontract and consultant requirements. The policy itself has not changed compared to FY24's policy. FY24 was when we had made the update to documentation requirements, but over the past year, we have observed that we're still receiving documentation for any subcontractor or consultant. So I wanted to take the opportunity today to clarify what the updated requirements are, and just to make sure we have an opportunity to answer any questions. And I am seeing a couple questions coming in before I get into the section. I am seeing some questions coming into the webinar chat. I just wanted to remind the audience to ask your questions in the Q&A portion of the Zoom webinar. That way we can record any question that comes in and record the response for that too, so we can post that publicly as well. Thank you. So for this section, I'm not going to go through the entirety of the language of this policy. This, of course, can be found in our policies and procedures manual. The use of subcontractors has always been an allowable cost for MOVA. This can be professional services that are within the scope of your MOVA funded services. This can be for legal services, interpreters, bookkeeping, and accounting. Over the course of the award, so this is the language that we mainly wanted to clarify. So we are now in year-to-year contracts. I know for many programs that have had contracts with MOVA over the years, like at one point in time, we were able to do multi-year contracts, but we are now in a yearly renewal cycle as FY25 is right now. So we are in a renewal cycle, and the course of the award would be the start of your contract and the end date of your contract. So this year would be the state fiscal year as we typically operate on, so July 1st through June 30th. So over the course of the award, if the subcontract, let's say, I'll use one example. Let's say that you have a subcontractor, a bookkeeper that is outside of your organization, and this bookkeeper helps track all of the expenses related to your MOVA award. Initially, you may budget $5,000 for this cost, and over the course of the year, the fiscal year, if the cost exceeds $10,000, and if you have to do a budget amendment to adjust that specific contractor line item, then additional paperwork will be required. So I'm just going to jump to the clarifying slide. So this is the policy itself, and the policy for the consultant requirements is similar. The documentation is only, the additional documentation is only needed when the cost exceeds $10,000. In FY24, we have allowed rates to exceed the federal consultant rate, which currently is $81.25 per hour, or $650 a day. So the rates can exceed that amount. However, we would just need additional documentation in order to support a higher rate. And the forms can be found on MOVA's website. And anybody, MOVA team, correct me if I'm wrong, but I think we're looking to get those forms on eGrants as well. So the piece of clarifying again is the subcontract request form, which would apply for both subcontractors or consultants on your budget, is only required if it exceeds, if the cost over the fiscal year exceeds $10,000. So the subcontract request form, it will ask for additional information, like, for example, what was your process to secure said consultant or contractor? Did you go into a procurement? What is your procurement processes? So it asks additional questions of that nature, and also requires that you have a contract on file if the amount is exceeding $10,000. And the contract would have to be provided to MOVA as part of the documentation support. I'm not seeing any questions related to this yet. Again, we will have a open Q&A, so if anything comes up, I'm happy to answer any questions, but we mainly, again, this is not a new policy, but we just mainly wanted to clarify when additional documentation is needed. Not necessarily a new allowable cost, but another point of clarification that we wanted to highlight today, because we are seeing an increase of this type of request. So related to bonuses or sign-on incentives, we are seeing several budget amendments, and typically the trend has seemed that we're really kind of noticing this more towards the end of a contract cycle, so the end of the fiscal year. So because this has been coming up more often throughout our grant cycles, we did want to include clarifying language in the policies and procedures, just to make sure it was clear what was allowable, what limitations may be considered. So this language can all be found in the updated version of the policies and procedures that Kristen has provided in the meeting chat. So it is allowable expense for personnel that is included on the budget. So sometimes we see that there's a request for bonuses for individuals that may have worked on the award, but they are not necessarily on the budget. So because of the funding picture, because awards are overall decreasing in size, we did add clarifying language here that it could be allowable for personnel who are included on the budget. For bonuses to be allowable, this is a key piece that your program coordinator may ask when this, if this is included in your budget, or if you submit a budget amendment that includes bonuses. They must be reasonable, necessary to support the work that is funded under the award, and distributed equally among all employees without regard to funding source or the funding source being used. So an example of this, if you have your VSS funded program and you're proposing a budget amendment in order to maximize the use of your grant award, you're proposing a budget amendment to have all employees on your VSS funded award receive a $1,000 bonus each. When we ask for additional justification for this, we would want to make sure that each agency is ensuring that not only the VSS funded employees, or the MOVA funded employees rather, are receiving the bonus, and that it's equitably distributed across your organization. So bonuses must be, I kind of touched on this right now, they must be appropriately and equitably distributed among funded staff, and that is according to the time they're funded on the award. So if you have full-time employees on the grant, and then some employees that work a couple of hours to do some admin work on the grant, the decision for bonuses must be prorated in order to distribute that equitably across staff. So we would expect not to see that half-time and funded employee would be receiving the same bonus as a full-time funded employee. The total cost for bonus requests may not exceed 10% of your total award. On a case-by-case basis, MOVA can consider amendments that exceed 10%. However, I would just note that any amendments that are exceeding 10% that may feel outside of the scope of what we are originally funding may be considered within the annual risk assessment evaluation. So we really tried to minimize amendments that exceed 10%. But if you have any questions about that, our program coordinators are here to provide technical assistance related to budget amendments. And last thing that I would highlight on this is that any bonuses that are included as part of an original grant proposal or budget amendment, it must be in writing to MOVA. And all of the justification as mentioned above, making sure it's reasonable, equitable, and necessary must be included as part of this request. All right. I will pass it along to Madeline, is going to do our overview of the annual civil rights requirements that we do every year with this training.
As Kristen mentioned, this is probably not new information to everyone. We do talk about this every year. There haven't been any changes to the civil rights requirements. So what you'll see in the FY2025 version is the same as what you were using last year in FY2024. But I do want to review them and do a brief overview today. So the first requirement that I want to talk about is the requirement to do the civil rights training. Kristen, can you advance the slide? Thank you. So the first one is to do the civil rights training. This is something that at least one key agency representative has to complete every year. There's a link in the slide. There's also a link in the policies and procedures manual that will take you to that training and walk you through the parts of the training that you have to do. There are video recordings that you can view. There's also a transcript that you can read through. There is nothing when you do this training at the end that provides you a certification of completion. So we just ask that you keep track, that somebody from your agency completes this once per award cycle. So somebody should probably be doing that now if they haven't already for the FY2025 awards. And then you just document who did the training and you keep track of the fact that those trainings are being done once per award. The next one, this is also not new, but the Equal Employment Opportunity Program, or EEOP. This is also something that has to be completed every year. In FY24, there were changes to how the EEOP is completed. These aren't platforms that we control at MOVA, but we did include here, it's also in the P&P, the information about where to go and how to complete the EEOP. So one thing that's different that they changed in FY24 is that there are two different reporting platforms that you can complete the EEOP on. So you'll see that there's one link for agencies that receive direct federal funding and one for agencies that do not receive direct federal funding. The process is very similar, but there's a different link that you should follow to complete and a different job aid that goes along with each process. So if the only federal funding that your agency receives is the federal funding that you receive via MOVA in one of the awards that we're administering, then you should be using the second link on this slide for agencies that do not receive direct federal funding. If your agency is receiving federal funding of some other type directly, and that's not federal funding that is coming through MOVA, then you should use that first link for agencies that receive direct federal funding. So this is something that needs to be completed every year. It's something that's easy to forget. I have a calendar reminder on my calendar to remind me to do it for MOVA every year, but this is part of your requirements for your award. Another part of the civil rights requirements are around ensuring that there is not discrimination, both in the employment practices of your agency and also in service provision. So in those two different realms, both employment practices and in service provision, there are kind of similar parallel processes that need to be in place. So one is that you're developing written practices to mitigate discrimination. So either in employment practices or in service provision. And for both of those areas, you want to make sure that that either the employees or prospective employees or the participants in your program or prospective participants are informed of your non-discrimination practices. You also want those practices that are documented to show either employees or prospective or current participants how to file either a grievance or a complaint if they need to allege discrimination. And so there should be due process standards as part of that. It should go beyond just saying, you can file a grievance or a complaint if you've experienced discrimination. There should be documentation outlining what the process will be like, who the person is, who would be responsible for following through on this process, what the timeline might be, information like that. So this is something that all agencies that are receiving funding from MOVA should have in place. So this kind of goes along with the previous ones. If there has there been a claim and then an actual finding of discrimination that was issued by a federal or state court or federal or state agency, that should also be reported to MOVA. So if something like that happens, if there are any adverse findings of discrimination based on any of the protected categories, race, color, national origin, sex, religion, that should be forwarded to your program coordinator, or you can use the MOVA grants email address, and that should be done in a timely fashion. Also similar, MOVA also has a process for filing discrimination complaints. Can you move forward one slide, Kristen? Thank you. So we also have a platform on our website that's accessible to any subrecipient, any person who is seeking services at any of your programs. If there is a complaint of discrimination, people can utilize this form, can file and document a complaint. This is completely voluntary, but it is a process just like all of your organizations need to have a process in place for filing discrimination complaints. So does MOVA, as we also receive federal funding. So there's a link on this slide that will take you to that complaint form if that is something that anybody, either an employee or somebody seeking services, would ever want to complete. And the last part that I want to go over related to civil rights requirements is having a documented language access plan. So the hope is that we're ensuring that services are accessible to everybody, including people with limited English proficiency. So the language of the requirement is a little bit vague or open. It uses words like taking reasonable steps to provide meaningful access to the funded programs and activities. But part of that means there should be both interpretation and translation of vital documents that are, important to service provision at your agency. Also, that access needs to be provided at free of charge to the individual served. So if there's a need for interpretation, that should not be a cost that is passed on to whoever the person is who is seeking services within your agency. On MOVA's website, within this past year, there was kind of an overhaul of the webpage that's related to civil rights and non-discrimination resources. So if anybody wants any more information, there's more information about these requirements on that website. There are also sample policies, sample templates. So definitely that link at the bottom of the slide is a place where you can also find additional resources, both about language access plans and about all of the other civil rights requirements that I spoke about during this section.
The only thing I would add to that, Madeline, is regarding the link. So I know we received many questions if this presentation would be recorded. We will also share the slides separately, separate from the recording as well. So everybody will have access to the slides and then ultimately the links that are within the slide. And I just wanted to say that out loud because the next section that I will be going through has several resources and links to cover. So Madeline, I'm not seeing any questions right now about the civil rights requirements. So I think we are good to move on to the next. And this is the last section before we jump into the registration questions and answers and then some open Q&A. So I am going to go through the upcoming changes to the federal uniform guidance, which may be more familiar to audience members as 2 CFR Part 200. That's a uniform guidance for all federal grants. So in April 2024, so this is a very recent change, the Office for Management and Budget had made revisions to the subpart E of the uniform guidance. There was an opportunity to comment publicly on the changes, and we were in favor of the changes that they had proposed as part of this overhaul. And we are going to, there's 3 elements of these changes that will have an impact on MOVA's grants, policies, and procedures as we pass through funding to victim service programs throughout the Commonwealth. So the changes will take effect after October 1st, 2024. So the current version of the PMP, which has been posted and shared, and also shared in the Zoom meeting chat today, this current version does not yet reflect these changes because they will not be in effect until October 1st. So when it's time to take these changes into effect, we will update the policies accordingly, and those will be announced and shared on Constant Contact as well. And to the piece about links and resources that are shared today, again, we'll share the slides so everybody will have access to this link here, but the Federal Register, you can preview more information about the changes that are to come with the uniform guidance. One of the most significant changes that we'll start with, so the de minimis indirect cost rate may increase from 10% to 15% of the total modified direct costs. So programs who are not utilizing and not negotiating federal rates or with a federal entity to agree upon an indirect rate and going through that negotiation process. And for those programs that currently utilize that 10% de minimis rate, you have the choice to change that rate to 15%. Unfortunately, that does not come with additional funding to be able to do that. So within the budget that is allocated and awarded for FY25, if you choose to adjust your indirect rate to the 15% after October 1st, that will have to be done through a standard budget amendment process. In this resource too, and I had just quoted from the Office for Management and Budget, but OMB had made this change because they felt that it was more realistic to the recovery of indirect costs that organizations are experiencing today. For equipment tracking, currently the threshold is $5,000 to keep a log of equipment that are items that may be considered equipment, and that threshold is increasing to $10,000. So slight change, but I think it will make a difference in the amount of tracking and documentation that will have to be done on the back end. But page 30 of MOVA's policies and procedures that page will outline more specifics of what type of information and what may be considered property that would need to be tracked as part of this award. The last significant change that will have a direct impact on the MOVA policies and procedures grants manual is the single audit threshold. So currently, if your agency is receiving $750,000 or more of federal dollars, you are required to undergo a single audit. That threshold is increasing to 1 million. And there is information about those requirements and audit requirements on page 26 of our manual. And I lied, this wasn't the last part before Q&A, but we did want to take the opportunity to go through common technical assistance trends that we see and that we frequently work with subrecipients to support.
All right, so I can go through these. I'll go through some of them quickly because some of them are things we've already talked about. But these are all things that kind of come up frequently in technical assistance. So this might be something that comes up during a site visit, maybe a desk review. Also, all of the program coordinators starting in FY24 have had open office hours. So that's also something that anybody can take advantage of. If you want some time to connect with your program coordinator, there's something you have a question about or want some support around. These are all things that we can work on you with to to be able to be in compliance with these requirements. So like Liam said, you all can continue, doing the work that you need to do, and we can continue passing through this funding. So in the area of Office for Civil Rights, some of the common areas that come up are EEOP compliance. So often that's just remembering to complete your EEOP every year. Almost all of you have practices in place around language access, but something that does come up is having those documented in writing in some kind of procedure or policy. And so that is a requirement to have whatever the practices are that you all do in your agency to ensure language access, that those are documented. Same with the non-discrimination provisions. So both in the provision of services and in employment practices, those are also things that need to be documented, that need to be in a policy, a written policy or procedure. Also something that needs to be available. So if you have a complaint process for people who are accessing your services, that complaint process has to be documented. It has to be something that's actually available to the people, to the participants or the individuals that you're serving. So those are the things that come up kind of most frequently around civil rights requirements. The next one are things that come up around financial management. Obviously, there's a requirement to accurately account for all of the expenditures and revenue by award and by the contract period. So that's something that does come up sometimes during site visits, for example. We'll be comparing the records of your agency to our records of payments to make sure that they're all in line. Kristen talked about this earlier, so I won't go into too much depth about it now. But that also includes that the revenue is tracked accurately and that it's tracked by funding source. So if you're receiving $50,000 over the course of the award cycle and $25,000 of that is from FOCA bridge money and $25,000 of that is from VOCA funding, that should also be tracked accurately. Kristen mentioned a couple of the ways that you can see that information, and that's also something that we're happy to work with you on if you want more information about how to do that and what the requirements are. Another thing that does sometimes come up, kind of related to what Kristen was just talking about, are for any agencies that do have federally negotiated indirect rates, that documentation needs to be current and active if you're going to be using that federally negotiated rate And we also need to be able to have documentation of what that rate is in order to be able to reimburse you for it. So for reporting requirements, a lot of these are kind of self-explanatory, but obviously timely and accurate submission of your monthly expenditure reports. So starting the day after the month ends, you can start submitting expenditure reports, and you have until the end of the following month to submit those. And also retention of the backup documentation for all expenditure reports. That has to be kept in place. That is often reviewed during desk reviews. Depending on your monitoring level, you may or may not need to be submitting that backup documentation when you submit your expenditure reports, but the expectation and the requirement is that that is still all retained within your organization, whether or not you need to be submitting it with expenditure reports. Similarly, timely and accurate submission of performance reports. So those are your quarterly OMTs. Like expenditure reports at the end of the quarter of performance for the OMT, the first day of the following month, once the period has ended, the OMTs will open. There's a month to complete them. And this is something we did talk about a little bit before, and we'll talk about more in the Q&A, but only data that is related to the MOVA administered award should be included and reported in your OMT. So a little bit more information about the reporting of only award specific data. This is a newer area of focus from the federal government going along with the VOCA funding, is to validate all of the reported data that comes in the quarterly performance reports. So starting in FY24, we have been following suit in order to make sure that all of our processes are in order, and that we're in a place to continue receiving the federal funding to pass on to all of you and support the work that you're doing. So during site visits, if you've had a site visit during FY24, you'll know that we are asking for data to validate or backup information to validate what has been reported in the OMT. Moving forward, that's a practice that will continue. Over the course of the past year, we've worked with a lot of programs individually to make sure that there's a process in place to be tracking the people you are working with and the services that you are providing, and that all of that information is kept. Some people use databases to do that. Some people use either electronic or even paper tracking sheets. All of those systems are totally acceptable. It's what works best for you. But we just want to ensure that that information is retained and kept, and that validates what's also reported in the quarterly OMT.
All right, so let's transition over to questions and answers. So Madeline and I are going to go through a couple of questions that came through with registration, and so it's currently 2 o'clock. We have this scheduled until 2:30, so I believe there should be plenty of time for some open questions and answers. We have responded to a couple in the meeting Q&A, the Zoom portion of the Q&A. There are a couple that I'd like to say out loud, but I'll hold until we get to the open questions and answers, just so we can get through the slides. So Madeline had touched on this earlier, but one question that we received is, are we still reporting on all clients served by our program through other funders? The answer is no, definitely not. We do not want data from services by other funders. So only individuals who are served and services that are provided under the MOVA funded award should be included in your OMT reports. So just no matter what funding stream you are receiving from MOVA, if that's VOCA Bridge, VOCA, DDTF, HCTF, they would all be reported as a collective in the OMT, but we do not need data from like VAWA supported services or other funding source, other funders. We only need the data that is supported by MOVA funding. Was there anything, Madeline, that you wanted to add to that?
I did. Is it possible for you to go back 2 slides? There were a few things that I wasn't able to get to before we moved on to. Okay.
I'm sorry.
No worries. One more forward. Okay. So in addition to kind of looking at that backup documentation to support and validate the data that's reported in the OMT, something that has been coming up is that for some agencies and in some service provision, it's been really easy for people to be able to know what exact individuals served and what services provided are tied specifically to your award. And for some people, they have a data management system or a tracking system, a database that really makes that easy. And some people are doing that in paper, and there's still a process that makes that easy. Maybe there are only very specific services that you are supporting under the award you get from MOVA. So it's really easy to track what is applicable to this award. For some agencies, that's not as easy. And in a situation, for example, if I'm an advocate and all of the services that I'm providing are all support services to survivors of domestic violence, and half of my time is funded by the MOVA award and half of my time is funded by something else, sometimes that's a situation where it makes it harder to know exactly what services I'm providing and what people I'm providing services to that should be included in the OMT. So if you don't already have a process in place that clearly tracks which individuals and which services are specific to this award, there are a number of different strategies, including prorating strategies that could be applied. So like in the example that I just gave, I'm providing support services to survivors of domestic violence. That's what I'm doing in my whole full-time 40-hour-a-week job, but only 20 hours of that are supported by this award. That means that if I have worked with 20 people, I should be reporting half of those people and half of those services because half of my time is supported by this award. So there are a number of different potential prorating strategies. On our OMT webpage, there's more information about different types of prorating strategies. We'd also be happy if there's any agencies that want to kind of talk through what that would look like specifically for your agency, for your funded staff and services. We'd be happy to set up a time to talk through what that might look like and kind of troubleshoot the best ways moving forward. We also have, I'm sure many of you have seen, there's an Excel-based tracking sheet where people can track the services and the individuals served and the services provided. We also have a version of that that will automatically prorate for you. You can enter in the number of funded hours from different staff, how much of that time is supported by the award, and it'll give you a prorating percentage. And it'll apply that automatically to all of the data that you enter into the tracking sheet. So if you entered in 10 services, but I was only partially funded, it'll do all the math for you. It'll tell you you have 5 services you should report. So we do have some resources like that that we would be happy to share with people if it would be helpful. We're also thinking about doing a optional kind of like data prorating technical assistance session either later this summer. So that's not a requirement that anybody attends. If you feel like you've got this all straightened out and you already have a system for it, no need. But if anyone's interested in that, that's something that we'll definitely be providing some more assistance on because it's something that has come up a couple times in the past year. Sorry, Kristen, to take us back, but now we can move forward again.
I apologize for that oversight and skipping over that because that's definitely an important piece of what we wanted to cover today. we are getting a couple of questions about that. I think let's save them till the Q&A part, unless Madeline, you wanted to address any of those right now.
I haven't had a chance to look at them yet because I was talking, so I'm happy I can look them over now if we want to keep on moving through the questions.
Yeah, we'll look at them after. Great. Okay. Well, Madeline had touched on this piece again through the prorating strategies and then other funding in general. As I had stated, only the MOVA supported services should be included in your OMT reports. This question had actually come up in the Q&A as part of the Zoom webinar. So how does MOVA define problematic sexual behavior for data tracking? This is one of the new categories that Madeline had touched on earlier as part of the expanded OMT categories that can now be reported. So the definition is here on the slide. So sexual behavior is initiated by children and youth under the age of 18 that are not developmentally appropriate and or potentially harmful to the individuals or individuals impacted or the individual initiating the behavior. So in addition to this definition, our data team is working on some resources that will further provide some information and definitions around these expanded categories. Madeline oversees the data team, so if there's anything on that note, Madeline, that you'd like to add to that point as well.
Yeah, there are a bunch of resources on the webpage already, but there are more that are about to be added, and they'll be providing definitions, more expansive definitions for everything that's included in the OMT. I do think that this is one of those fields I had mentioned before when I was talking about the additional reporting fields. This is a good example of something that we wouldn't expect absolutely every single one of you to be reporting on. So this is something that is commonly discussed and commonly reported on from children's advocacy centers, for example. They're doing a lot of work. A lot of them are doing a lot of work around problematic sexual behavior. If your agency is providing services, someone is coming in and you're providing services in the aftermath of a drunk driving accident, we wouldn't be expecting that you would be screening for problematic sexual behavior. So this is a field that we're making available to those that it applies to. So we have a place to record and report that data. But this is not something that, if it came up, we would expect you to have the capacity to record it and report it. But this is something that probably is more specific to dependent on what type of services your agency is providing. I can do this one as well, Kristen. So one of the questions that we got was, could you provide an overview of the outcome measurement tracking? So this is something that we'd be happy to do. Sometimes it's helpful to do that on an individual or like an agency specific basis. There's a lot of information on the OMT page of the website. There are recorded videos that show you how to do this in the OMT and e-grants. There are also tracking resources. I had mentioned before that there is a data tracker that you can use. It's not required, but it's optional if you'd like to use it, where you can track individuals served and services provided. The resource that's on the website now also includes places to track progress on both your goals and key outcomes. So if that's not something you have in place and you'd like to use that optional tool, you definitely can. The link to that OMT webpage is included in this slide. But if you would like a kind of more detailed overview about how to do outcome measurement tracking, whether that's the data on individuals and services, whether that's data on goals or key outcomes, please feel free to reach out to either your program coordinator or to movastats@mass.gov, and we can definitely provide, if you have specific questions about how to track that or how to report that, we can definitely meet with you and kind of walk through your questions and provide more of an overview. Similarly, there's also been a couple questions like in the Q&A that I've been seeing. Can I amend my goals and outcomes due to less funding available? So every time you're setting your goals and key outcomes, they should be reflective of that coming year's award. So when you all set up your goals and key outcomes for FY2025, you should have been setting them up based on the award information you had, the award you had for FY2025. So they should always be appropriate and attainable for your program. If the award is reducing, we do not expect that you are still able to support the same amount of services as you did when you had more funding. So it's not a bad thing to reduce those goal numbers if that's what's appropriate with the current level of funding you have. But if that is something that didn't happen, or I did also see a question about goals and key outcomes reflecting work of the entire agency rather than just specific to your award. So if there is something that you would like to adjust, definitely reach out to your program coordinator. We usually set those for the year. So everybody right now has them set for all of FY2025 and you'll report on those each quarter. But if you'd like to make adjustments, you can definitely reach out to either your program coordinator or MOVA Stats, and they'll work with you to update those measures.
Sorry, I was on mute. The last question that we have received is, there were a lot of pre-questions or pre-submitted questions related to data in the OMT. So will MOVA be working with EmpowerDB to offer some flexibility around timing of reporting new data? So we have shared the updates to the FY2025 OMT with EmpowerDB. If your organization does work with them, we would also recommend that you are in touch with them directly. So MOVA does not have a contract with EmpowerDB. We do communicate with them to inform them anytime that there are any updates to our reporting mechanisms, but we would strongly recommend that you are also in touch with them. All right, so we're going to shift over to open Q&A. So if you have any questions, there are a couple that Kristen Tavano has been answering some in writing that have been asked throughout the session. There are a couple that are still open. So I'm going to ask a couple of these out loud. Is it up to the discretion of the professional as to whether the example you gave is classified as problematic sexual behavior or child sexual abuse? I would suggest yes, it is up to the professional who is working with the victim survivor to make the discretion as to what category it best the service is best fit under. When calculating percentages of MOVA funding, are we including fringe or just employee-based salary? I would suggest that it's the entire personnel cost, including their fringe. So it should be both when using when prorating data.
There's also a number of different ways to prorate data. The most important thing is that they are applied consistently. So if you were going to be, so I think the most important part of that question is that you wouldn't want to compare two unlike things. So you wouldn't want to, if you were using me and Kristen, for example, you wouldn't want to include fringe and base salary for me and not do the same for Kristen. So you would just want to have the same process when developing a proration strategy. Thank
you. Are we reporting every client new in the first and second quarters? Now that we've made the change, it is only in the first quarter. So previously it was the second quarter. Now the reporting clients is aligned with the start of the fiscal year. So that should only occur in the first quarter of the award. Madeline, there's a question about the definition of pregnancy. I don't know if I know we're currently working through more specific definitions. I'm not sure if you have the information to answer this one at the moment, but
I do not think that you need to be screening anybody for whether they have ever had a history of pregnancy. So this is really in special classifications. Oftentimes people have been reporting in other pregnancy or pregnant. And so I think that is largely data that has been collected when it feels relevant to the services that somebody is seeking or whatever the crime was that occurred. And so that would be the time where you would want to be including that information if that's something that you're tracking and that is relevant to the service provision or the victimization that the person experienced. We wouldn't need you to be screening unless that's a practice of your agency for some other purpose. That is not, but that would not be necessary for us to know. This is really all related to the victimization, so it wouldn't be necessary to know like every single time, anytime anybody has a history of pregnancy.
Madeline, I have something from Amelia as well. She has our definition of this, and it's a victim who is currently pregnant or pregnant at the time of victimization. It does not matter if the pregnancy was related to the victimization or the catalyst for victimization. I can drop that in the response as well.
Great.
Thank you, Kristen and Amelia. There does seem to be an appetite for the prorating technical assistance, as Madeline had touched on. We are looking to have a future technical assistance session, but outside of that, we're certainly available for some one-on-one technical assistance if you have questions that are more specific to your program and how some of the prorating may fit in your funded services. So our team is available to do some one-on-one TA as well. I'm not seeing any open questions.
There was one question in there. What is your definition of all clients? And will we be going back to tracking non-clients? And I had just asked if that was safe plan specific, but Madeline, if you have any insight into that.
I would assume, my guess would be the same as yours, Kristen, that was a safe plan specific question, but no, if the individual is not is not receiving services that are funded by the award, if the person isn't eligible to receive those services, that would not be information that would be reported to us for the funded award. It's up to your agency to make decisions about, if somebody comes to your door that's not eligible to the service, perhaps they need help with resources, but they aren't. Your agency is working with survivors of sexual violence and that person has not experienced sexual violence. Your agency, obviously, it's up to your discretion about how you handle those, whether you provide, how you provide the person with resources. But if they are not somebody who would be eligible for the services funded under this award, that would not be something that you would then track and report as related to this award.
Well, we have about 5 minutes left in the session, so we'll stay online for a couple more minutes to see if there are any final lingering questions. Hopefully we'll have some good news to share later about Boca Bridge. I know Isabel's still on the call, so I'm not sure if there's any immediate updates, but hopefully we'll have some good news to share by the end of today.
Yep. And just also want to encourage anybody, if you have questions, this really What we covered today really were things that are changing for FY25 or things that felt like they required some kind of like refresher or extra focus, points of clarification. But obviously it is not inclusive of everything that's in the policies and procedures manual. So please reach out to, to your program coordinator or to any of us if you have questions. We love having the opportunity to connect with all of you and to talk about the work that you're doing, and if there's any ways that we can support that, or try to help you, for example, come up with a strategy to prorate your data, or find the most streamlined way to include this information in your intake process. Whatever it is, we obviously would we're here and we are open to, talking through that, providing any assistance we can, answering your questions. There aren't bad questions, there aren't dumb questions, especially if people are newer to working with us or working with one of the MOVA administered awards. This probably didn't answer all of your questions about everything. So feel free to reach out. The best kind of first points of contact is usually your program coordinator. If you reach out to them and ask your question, they will make sure, if it's a question that it would be great to have Isabel be a part of the conversation for, it would be great to have Hannah and Amelia from our data team be a part of the conversation. Your program coordinator will kind of make sure to get those, to organize within MOVA and get the right people on the call to answer your questions. So feel free to reach out.
All right, with that, there are no more questions. So we will stop the recording and stop the presentation. And as Kristen said in the chat, this will be shared over the next week on our website and on Constant Contact. So thank you all for attending, and I hope everybody has a good rest of the summer, and stay tuned. Hopefully, again, fingers crossed for some good information. So we'll be in touch. Take care, everybody.
Bye.